I took a job as a night nurse at an old hospital that was slowly shutting down. Most of the patients had been transferred elsewhere, leaving just a handful in one wing. My shift was usually quiet, until I met room 304. It started with small things. The call light for 304 would flicker, but when I checked, the room was empty. I asked the other nurses, but they just exchanged uneasy glances. "That room's been empty for years," one finally muttered. But I wasn't imagining it. Some nights I'd hear faint breathing through the intercom. Once, I caught a glimpse of a shadow by the window. The worst was when I found a patient chart at the desk, one I didn't recognize. The name was Margaret Lively, admitted in 1978. Curious, I checked the old records. My stomach turned. Margaret had been a patient in room 304, a woman who had vanished without a trace. The hospital had searched, but her body was never found. That night, the call light for 304 flickered again. I stepped inside, my heart pounding. The air was ice cold. Then, behind me, a whisper, so close it brushed my ear. "You finally found me."